Epilepsy is two or more unprovoked seizures, or a single seizure with an enduring tendency to have seizures. 1 out of 10 people will have a seizure at some point in their life, but that's not epilepsy. Now, there are peak times when it tends to begin. One is in childhood and early adulthood, and then it levels off, and then there's another increase after age 60. Sometimes folks can have such brief seizures and that you have to have someone tell them, and they don't even know they're having the seizure because it's so brief, and then they're told that they had something. Epilepsy occurs pretty frequently, though. 1 out of 26 people have epilepsy. There are certain causes, there are certain genetic causes of epilepsy. Sometimes head injury can do it, having a stroke. Then there's triggers. Triggers are different. Triggers would be like sleep deprivation, in some patients, flashing lights, video games. That's actually pretty rare. People ask all the time about, do video games cause or trigger seizures? And usually not, but there are some times when that does happen. Other triggers would be excessive alcohol. There's a lot of misconceptions about it. I think that a lot of folks feel that restricts them greatly, that they can't drive ever, they can't marry, they can't have children, and none of that is true. The signs and symptoms of epilepsy are just the signs and symptoms of the seizure. So the seizure is the symptom. And so otherwise, you're not going to have any signs and symptoms. So the signs of a seizure can vary a lot. And so they can be anywhere from a hard seizure, a generalized convulsion, what people normally think of as a seizure, or a seizure could just be a staring spell, and that staring spell could last 20 seconds or a couple of minutes. If they're having a big seizure, the grand mal seizure, what you normally think of as the big seizure, the best thing to do is just roll them on their side. You don't want to put anything in their mouth. Certainly don't put your hand in their mouth or even your wallet. Just turn them on their side. That's the most important thing to do. And normally seizures last about 1 or 2 minutes. And if they last only that, they'll go away, and it's for that particular seizure. That's great. If they get really prolonged, like 5 minutes or so, then you may have to call for an ambulance. Call 911. SUDEP stands for sudden unexpected death in epilepsy, and that usually occurs in people that have uncontrolled seizures, and especially folks that don't take their medication. So the biggest risk for this is to forget your medication or to run out of your medication. So I think that's why it's very important to always take medication. If you have other medications, you can usually do without 1 tablet or so, and it's not going to be that serious. But if you miss a couple of doses of epilepsy medicine, that could have serious consequences.